It's 5:30, so we'll call to order this meeting for Monday, October 26th. Karl, would you start us off with a roll call, please?
Councilmember Remley.
Present.
Ronayne.
Present.
Lunsman.
Present.
Reif. Johnson. Reinbold.
Present.
Langer.
Present.
Rux.
Present.
Mayor Schoeneman.
Present. Please stand with me for the Pledge of Allegiance.
Pledge allegiance to the flag of the United States of America and to the republic for which it stands, one nation, under God, indivisible, with liberty and justice for all.
I'll ask for a motion to approve last week's minutes for the council meeting of October 19th.
So moved.
Second.
Got a motion from Councilman Rux and a second from Councilman Reinbold. Karl, would you give us a roll call vote, please?
Councilmember Remley.
Aye.
Ronayne.
Aye.
Lunsman.
Aye.
Reinbold.
Aye.
Langer.
Aye.
Rux.
Aye.
Mayor Schoeneman.
Aye, motion does carry. Move along to our open forum. We've got one open forum speaker here, and it's our very own Tiffany Langer, who will be reading a letter from Dr. Blake Hines as it relates to COVID. I would like to remind the council that this is not a time for problem solving or reacting to comments by rule, but rather for hearing citizen information for purposes of that nature. So with that, Tiffany, why don't you take it away?
Thank you. City Council, I write to you as a trained internal medicine physician and medical doctor of the hospitalist group here in Aberdeen. I received my doctorate alongside a master's in ethics 8 years ago, trained in Minneapolis, and promptly returned home to the city I was born and raised. I've had the privilege of caring for our local community and greater region for about 5 years, and in that time, many of you have entrusted my service in the care of your friends and family. I feel it is my duty to share my increasing concern of the risks that COVID poses to our community, and that is why I write to you tonight. COVID has begun to significantly impact our local area. Within the last 3 months, beginning in August, there has been an appreciable change in the number of admissions to my place of employment. April through July, we had single-digit admissions, which is an important point to remember. During this time, we had a significant COVID outbreak at our local meat packing plant that was dealt with confidently and I believe kept our numbers low. Since August, however, there has been a doubling of hospital inpatient admissions. In August, we had 14 people admitted with COVID. In September, 33. So far in October, as of 10/22, 55 admissions. Dating back to our first admission in April, we had over 114 admissions. Furthermore, there have been 10 deaths. In that period of time, we have enacted massive changes at my place of employment. I am very proud and inspired by the dedication, flexibility, ingenuity, and fearlessness of my team, administration, and hospital staff. I am grateful to the community as their sacrifice early on in the pandemic gave all of us the time to prepare. Every single healthcare member, from physicians and healthcare administrators, to our physical, speech, and occupational therapists, to our chaplains and housekeepers, we have all stepped up. Our confidence in being able to care for these complicated patients has grown, but has certainly taken its toll. All of the medical staff has worked overtime, putting in hours far beyond what is expected, some of us working nearly double our usual shifts, with a hospital census that is nearly maxed every day. The moral distress, unanswerable clinical questions, and ethical challenges that are being posed exuberate an anxiety that comes from the knowledge that there is no end in sight. In fact, with rising numbers of positive cases in South Dakota, I expect the number of admissions to continue to double. It should be very apparent the number of available beds that is often cited by government officials likely includes surge level capacity. Sure, our hospital has over 100 beds, but we do not have that amount of trained staff to provide care unless we draw nurses from our clinics, which would negatively affect their care as well. The ICU I oversee has 10 beds. We typically have the staff for 6 to 8 of those. These are highly trained nurses in critical care and are already in short supply. I am worried about my community that I've grown up in. I am worried about my colleagues and the trauma they have left to endure. But most of all, I am worried about my future patients, your friends, your neighbors, and your family. I am worried about what I will have to say to them when our limited therapeutics and supportive measures fail them. I am worried that if our numbers continue to climb, we may not have the resources to care for them. I have already seen this virus take people prematurely. I have seen the personal guilt of family members who have given the virus to their family, and now their family is forever changed. I have been at the bedside of dying patients with the knowledge that the virus that killed them is communicable, unpredictable in its severity, and most importantly, preventable. It is widely known and shared that the mortality rate of COVID is low. On average, across all ages, 1 in every 200 affected individuals will die. This does not account for the disabling chronic disease that can occur after recovery. It also does not factor in the still yet to be clarified cardiac and neurological complications this virus seems to cause. I have cared for recovered cases who have later been admitted with otherwise unexplainable new onset heart failure, new cases of blood clots in the lungs, and sudden onset diabetes. At the present time, there is no evidence of a local plan to prevent infections, and therefore, the de facto plan then is herd immunity. With Aberdeen alone having roughly 28,000 people, that translates to potentially the death of 140 people within a very short period of time. This includes the assumption that there will be an appropriate therapeutic, trained staff, and enough resources to give each patient the best possible outcome. The death rate in New York, Italy, and elsewhere was likely so high because resources were strained, staff was limited, and the virus spread undetected. With rising numbers and a backlog of cases that our contact tracers have yet to call, our New York moment seems like it is fast approaching. I believe that without community action and a reinvigorated, aggressive educational campaign by local leaders, we will see our numbers continue to climb, unabated, and risk overwhelming our hospital resources. With an already fatigued medical staff and the worst yet to come, I absolutely implore you leaders to formulate a plan and educate our community. Now is not the time to focus on the deficiencies of imperfect protections, like masks, so much that it paralyzes us to any action at all. We cannot let the perfect be the enemy of the good. There are many examples of communities and states that have enacted measures in a stepwise fashion as case counts and numbers of hospitalizations rise. Make no mistake, waves of COVID are only waves if they are aggressive behavior changes by the community. The wave will not rise, peak, and fall if there are no changes that cause the fall to occur. Instead, the wave will simply rise. Just like my team has formulated a surge model for our hospital, I ask you community leaders to formulate a surge model. At this time, I am not here to advocate for lockdowns, school closures, or personal hermitage. I am very aware of psychological and mental health complications that ensue. Please remember, I also take care of the suicide attempts, overdoses, and severe depression and substance abuse in my hospital as well. I recommend all of you take time to do a deep dive into the data on community COVID protections in an effort to preserve the future of our local economy, protect our ability to continue to send our children to school, and protect the lives of those we love. It is time to formulate a transparent plan that reassures everyone that you are ready for what is to come. With your elected leadership and power that comes along with it, you must accept the responsibility for the welfare of our community. Thank you for your time and consideration. Dr. Blake Hines.
Thank you very much for sharing that with us, Tiffany. We really appreciate that, and it really truly dovetails nicely onto our update that we will be receiving from Brown County Emergency Manager Scott Meintz on the same topic. Scott, are you with us here on, there you are, I see you. Scott, give us a few minutes of your valuable time over there and kind of give us that update that some of the council members were looking for on Brown County's COVID situation, please.
Absolutely. Thank you, Mayor and council members. The information that I'll give you tonight here is probably not a big shocker to most of you. Most of you probably get the charts that I send out a couple times a week. But today marked another milestone for Brown County here with we surpassed the 400 mark with active cases. This is our highest number we have ever claimed to. A few months ago, I was hoping we wouldn't get over 200. Then I was hoping we wouldn't get over 300. And I was hoping we wouldn't get over 400. And today we surpassed that. I'm truly somewhat not surprised by that, though. Our numbers have been skyrocketing since the end of July. We've been on pretty much a steady increase. There was a small decrease in mid-September, a little bump in the road that we dropped a few cases. But for the most part, since the end of July, we have been on a steady increase of active cases.
My office and a few other folks that I deal with on this on a regular basis have been trying to figure out who, what, why, where, when, and all this kind of stuff. And we have nothing factual. This isn't a school issue. This isn't a athletic thing issue. This isn't, a workforce issue. It is just basic community spread. It is across the board everywhere. Currently, we've had 4 deaths in Brown County. In my opinion, that's 4 too many. We've had 104 people hospitalized throughout this entire pandemic. With, I believe today we're at about 16 currently in the hospital, I think is what the numbers showed. Our first responders that we keep in track with quite actively are still actively manning calls for service. None of our calls for service in fire, ambulance, police, sheriff, any of those types of services have been changed. Those agencies continue to wear PPE according to the most current practices set by CDC and such forth. And we are continuing to review those policies and adjust as science, practice, and PPE is available. So again, we have not changed anything for that. As Councilwoman Langer read with the doctor, I have been hearing the comments that yes, the hospitals are stressed, beds are filling up, and workers are getting tired. They got a long ways to go on top of it. This isn't going to be over in a week, 6 weeks, or 6 months. We got a long ways to go. My wife works in the medical field and comes home every day, and she's pooped. I don't, we see the hospital numbers daily. I don't know if that also tells the full story there either, because we look at numbers that show, 50% or 80% or 15%, whatever those numbers would be. But there's sometimes day-to-day operations change so fast that they're not reflected in the numbers. So I think that it's sometimes a scary situation for our hospitals. When hospital administrators are calling and saying that they're out of ICU beds for a single day or for a short time period, that gets a little bit of attention. So, I think we've become a little complacent. We've had many changes over the last few months from when we started this pandemic. There's numerous things going on that were not going on earlier, 4 or 5 months ago. These things are not bad things. They're things that we need, such as school and work and things like that, and to be able to get out and shop and things like that. They're just changes that we need to be able to deal with, though. We need to make changes for the changes that have happened. I'm not quite sure how we do that, though. I think probably the biggest thing that we need to do is educate. I think there's still some people out there that think that this is a joke, that COVID's going to go away after the election and all those types of things. Regardless of the policy, we still have a personal responsibility to reduce the pressure on our healthcare systems and things like that. So again, I think this is a community thing. This isn't an Aberdeen City Council or Brown County emergency management problem. This is everybody's issue, and everybody needs to step up. We're going to have to work on this together to make those numbers go down. So again, I truly think we really need to just educate. We know that masks, social distancing, hygiene, and staying home, it does help. But we need all of those things. We can't just have masks. We can't just have hand washing. We can't just stay home. We need all of those things as a whole to make it work. So, the bottom line, if we want to see change, we need to be that change. We don't need to just talk about it. We need to make sure that we've educated the folks of our county and our city to make sure that they're doing what's right for them and their community. So I'll stand by if anybody's got any questions or wants any other information.
Councilman Rux has a question for you, Scott.
So the state numbers are sometimes a little confusing because everything is based on county. Aberdeen is a regional medical center, am I correct? And that
Correct.
people from Edmonds and Falk and Spink and Day and Marshall and maybe up in North Dakota, they get sent to our medical center because we have the two hospitals, higher grade ICUs, et cetera. Is that correct?
That's correct.
So the 16 hospitalized currently from Brown County may not be the accurate representation of what is actually in the hospital.
Correct.
In fact, if you look on the South Dakota's COVID site, you can see for the whole region, so
Yeah,
you can
I-
balance those numbers between.
Yeah,
what
I
Brown
look
County
at those
shows.
numbers, but other people may not
Understood.
see that far. so.
Councilman Ronayne, have you got something to add?
Thank you, Mayor. Yeah, actually, Scott, I'm curious, you made a reference to the ICUs being full. Have there actually been occasions in which the ICU has not had available beds?
I can tell you that I spoke with one of the hospital administrators. We had last week. We had one evening where they got a phone call because the ICU beds were going to be full. Now they were able to jockey some things around and make it work, but there has been an instance, yes.
Then my other question would be, I've been reviewing your numbers whenever I've been getting a copy of this, and it looks as though our positivity rate lately has been in the high 30s, sometimes even the low 40s. Is that how you calculate it?
Well, if the state started tracking the percentage of that rate here back in early, looks like 10/4, they started tracking it that Monday. And actually, today was the first day or the first week that we've actually went down. We went down right at 2 points. So that is a good thing. Again, it's maybe a little too early to say that we're on the right track, but it obviously is a positive move.
Yeah, and I don't. Yeah, and that's one of the reasons I ask you that is because I think I was watching CNN yesterday, and they were reporting that the South Dakota positivity rate for the entire state was at 37%, and that's why I'm curious. They must be calculating it in a different manner than I am.
Well, I can't answer that, I guess. I'm not sure how you're calculating it. I
don't
just go off
suppose
the
you
state
do.
website,
Yeah.
So Scott, another thing that I
Thank you,
saw
Scott.
on
Should be good.
covid.sd.gov was that there was a 2-week trend of reduction in new cases in Brown County. Would you say that holds true, or is that incorrect on their website somehow?
Again, our numbers, the daily numbers fluctuate a little bit. There's days we have 47, new positives, and then, the next day it can drop down to 20. I'm a little bit concerned of why, if you look at some of the graphs that I put out, the active cases versus some of the recoveries is starting to open up a little bit. Where are these people not recovering? Are we not making contact with them? That's one of my questions that has not got answered a little bit. But again, the charts are opening up a little bit to show more active versus recovered, if that makes sense.
Typically, all that is they text you and ask if you have any symptoms on the 14th day.
And you know that how?
I've had to go through that experience.
I know, I'm teasing.
That's why I missed 3 meetings in September.
Anything else for Scott while he's here? Thank you very much for joining us.
I just thought of one last question.
Talk
Early this spring, Scott, we had planned surge capacity for patients. We had planned location to have a surge capacity. Are those plans still in place, or do you feel that the hospitals are coping with that right now?
First of all, the plans that the EOC put into place, some of those are still active, some of them are not. Because of some of the locations that were going to be used Some of those locations are not available currently. So again, some of those locations are not available, but there was backup locations for those that would still be valid. Visiting with the hospitals since we started those plans, the hospitals have made big changes in their facilities and things like that. And I don't want to speak too much for the hospitals, but I'm comfortable with what the hospitals have in place for plans and surge capacities. Now, with that being said, we're getting into flu season, and if we start seeing a large number of flu patients being in the hospital that are taking up beds, that may change.
Thank you, Scott, and thank you for being late tonight.
He was right on time, Clint.
Oh, well, no. I mean,
No, I'm just, that's it.
he's probably off
Thanks
work now.
thanks for showing up late, Scott. Appreciate you being here and the information. All jokes aside, Scott,
Yeah.
we appreciate what you do, and those graphs are really helpful. So continue to send those out. We will move along to our consent calendar. We have possible approval of 4 items here tonight of routine city business. Can I get a motion to approve those consent calendar items?
Move to approve.
Second.
Got a motion from Councilman Lunsman and a second from Councilman Ronayne. Without any questions, Karl, why don't you give us a roll call, please?
Councilmember Rux,
Aye.
Langer,
Aye.
Reinbold,
Aye.
Lunsman,
Aye.
Ronayne,
Aye.
Remley,
Aye.
Mayor Shoneman.
Excuse me, aye. Motion does carry. We'll move along to our new business. The first item of new business is our first reading of ordinance 2010-03, authorizing the issuance and sale of bonds for the TIF for District 32 with a maximum allowable issuance of $4,333,678. Possible approval of that first reading here tonight. Karl, will you be telling us about that?
Yes, Mayor, thank you. This ordinance is being presented by the bond council that the developers for TIF District number 32 have employed. Todd Meyer Henry from Sioux Falls has done several TIFs across the state. This ordinance would allow for the issuance of these bonds, and the proceeds would then be used for the construction of the public infrastructure that's included in the project plan, and for the first 2 to 3 years of debt service payments that would be required as a part of this bond. Finance Office has reviewed the ordinance and agrees with it and approves, would agree with its approval. Recommend its approval. That'll work.
Sounds good. So I guess a couple of questions I'd have right off the bat. How does this relate to some of the other housing neighborhoods TIFs in terms of dollars and cents? Is 4.3 million pretty average for what we've been doing? The ones on the north side of town particularly? A little high, a little low?
Thank you, Mayor. Each TIF district is unique in the fact that there are different types of public infrastructure that need to be addressed. The city engineer may chime in if he thinks that the number that was included in the project plan for actual improvements is $2.8 million. That's why this bond is noted as being a maximum allowable 4.3. Within that 2.8 million, they've got some contingency plans in case the bids are over what the early estimates were. But the bond would only be issued for the amount that's needed for actual construction and for the first 2 years of the debt service financing, 2 to 3 years. I think it's right in line with some of the other, in my opinion, some of the other infrastructure costs of the other TIFs in that area. Looking through the project plan, it doesn't have anything unusual as compared to the other TIF plans in that area.
Sure, and I believe that the point of interest and so forth have been something that people have reviewed on this council in the past with other TIFs. Is the interest rate something that's published? I didn't see it in scanning through our
If
agenda
my
package
recollection is
here.
correct, I think that they were talking just a little bit over 5%, which in this environment is probably right in the ballpark. Some of the TIFs that we looked at, 3 years ago, 4 years ago, they were anywhere from 7 to 8%.
think we had a couple that were 9.
Yeah, a couple that were 9. That was in a different environment than we're in right now, but,
Sure.
so this one, I think, is right in the ballpark.
Sounds great. Councilman Ronayne has a question.
You know, first of all, I appreciated the mayor's questions because I had many of those same questions. It seems to me, Karl, as though we are used to getting more information about the project, about the budgeting, about the interest, about the payment terms than we have here. I'm just kind of uncomfortable with the lack of information that we've been given. All we have here is kind of the bare ordinance, which I don't have any problem with the ordinance, but I just don't know anything about the project. I don't know where it is. I don't know any of the numbers.
Yeah, that was with the original TIF plan.
Yeah, if I may, Mayor.
Would you
Please.
All that information was included in the project plan that would have been brought forth with the resolution for the creation of the TIF district and the approval of the project
Okay,
plan.
So this is the same one. I hadn't connected the dots.
Correct,
So
yeah, this is the
same-
next step in that progression.
Okay.
Yeah.
And this is for the north 54 homes that are up on 8th Avenue, correct?
Refuge retreats.
Yep,
Refuge Retreats is the
too.
name of this one,
Yep.
yes. That would be good information to have.
Yeah.
TIF district number 32 is all I need.
You know what you're talking about.
Mr. Tobin, if you'd like to make your way to the podium, if you've got something to share to make sure that we're all online. I just, I think that, with this amount of money, I think the public kind of expects us to do some due diligence, and I think most of us had probably read through that first one, pretty carefully, but I didn't notice those two questions, I guess I didn't, in relation to the other. So, Mr. Tobin, you're here to tell us something.
Thank you, Mr. Mayor. I'll take full responsibility for Councilman Ronayne's confusion. Oftentimes, the TIF proposal itself, the TIF project, is presented at the same time as the ordinance for the bonding. And in this case, we had 2 attorneys that didn't communicate very well. I assumed that Todd, Meyer Henry's bond counsel, was bringing forth the ordinance. Todd assumed we were, and we found out very late in the game that Todd hadn't brought it forward. So that's why we received approval for the TIF, I think about a month ago. And so I apologize, Councilmember Ronayne, because that's what probably led to the confusion, why they're not at the same time in the same information. But it is refuge retreats. There are 56 units. It's not individual separate housing that will be sold. It is going to be a rental complex made up of about 8 different buildings is the way it's originally proposed. The first building that's under construction right now is going to be 10 units. So that's essentially the project. It's 55 and older. So there will be some rules that govern that type of housing. And the infrastructure costs, maybe, I don't know that they're significantly higher. They may be slightly higher because we are obligated because of the size of the development. We are connecting, is it 6th or 7th? I don't know, the road comes down from Carlson Funeral Home and then loops around and connects to the existing housing development to the west. And then there's 2 cul-de-sacs that one goes north and one goes south. So there's a fair amount of public infrastructure necessary to do the entire build-out. So, and I'm here to answer any other questions that anybody has.
I'll move to approve.
Thank you.
Second.
Got a motion from Councilman Ronayne and a second from Councilman Rux. If there's no further discussion on the topic, Karl, why don't you give me a roll call vote, please?
Councilmember Remley,
Aye.
Ronayne,
Aye.
Lunsman,
Aye.
Reinbold,
Aye.
Langer,
Aye.
Rux,
Aye.
Mayor Schonman.
Aye, motion does carry. Thank you for your information, gentlemen. We'll move along to our first reading and passage of resolution of intent to lease 32 acres of city-owned land to the private person in 2021. Possible approval of the first reading and passage of that resolution with the intent to lease land to a private person, fixing a public hearing to consider the final approval of the lease and to authorize the finance officer to publish the notice of hearing as required by law. Ron, you're here to tell us about that.
Thank you, Mayor. This is a statutory process that we're required to follow, and we're going to do a better job from a staff side of making sure that we get these formally done. We've got a number of these tiny little pieces around the city that frankly are more of a hassle than almost anything for us to have to manage, and so some of these we're dealing with very tiny little leases, and we're going to go ahead
Councilman Rux for the first reading to publish this notice of hearing. Any questions for the city attorney? Otherwise, Karl, give me a roll call vote, please.
Councilmember Rux,
Aye.
Langer,
Aye.
Reinbold,
Aye.
Lunsman,
Aye.
Ronayne,
Aye.
Remley.
I think we lost assist.
Yeah, my screen isn't on at all.
He was unmuted for a second. Councilmember Remley? I think we're having some technical issues right now with the volume. You notice the mics went off. Mayor Schoeneman?
Aye, motion does carry. We will move along to our request payment authorization of $28,781 for the 2020 Dodge Durango from Wagner Auto Incorporated for the Aberdeen Ride Line. Possible approval of that payment. And then I'm not sure, do we have Tom then on the line?
Probably not.
Move to approve.
Second.
He's been here a couple times to tell us about this this vehicle from recollection. So got a motion from Councilman Ronayne and a second from Councilman Lunsman. Karl, why don't you give us a roll call, please?
Councilmember Remley? Ronayne?
Aye.
Lunsman?
Aye.
Reinbold?
Aye.
Langer?
Aye.
Rux?
Aye.
Mayor Schoeneman?
Aye, motion does carry. Next, we'll have the payment change order for the Klein Street Storm Sewer Improvement. Possible approval of payment number 4 in the amount of $17,801.80. Change order 3, which resulted in a decrease in the amount of $3,483 for B&B contracting for work on the project. Robin, thanks for coming up. What can you tell us about it?
This was last year's project. The boulevard restoration, those types of things did not happen until this spring, summer. So we held off the payment until those things were completed. Now the contractor's completed their obligations and we're recommending approval of payment and the change order for that work.
Move approval.
Second.
Got a motion from Councilman Rux and a second from Councilman Ronayne. Has anyone got any questions on that payment or change order? Karl, roll call, please.
Councilmember Rux?
Aye.
Langer?
Aye.
Reinbold?
Aye.
Lunsman?
Aye.
Ronayne?
Aye.
Remley? Mayor Schoeneman?
Aye, motion does carry. Next, we've got approval of the bill list for October 26th, and I'm not sure if it was a glitch in the matrix or what's happening here, but the list just says bills, and then the amount, they're not broken out or itemized. Are there particular bills someplace listed that people can access them?
I'm sorry. I was dealing with the power issue that's going on in back. That's not.
Got it.
That's, the list of bills,
Yeah, all it says is bills, 35,000.
was there not a listing of the individual bills?
No.
An oversight on this one.
Okay.
Can we table this for a week?
Or can we have the bills read, what they are?
Did you not see an email? I think they might have been emailed. They usually are. You didn't see that this week?
Yeah, Stacy emailed
The department
bills.
The
bill.
department bills?
Yeah.
the
That's
department
what
bills.
this would
it.
be.
That's
Yeah.
those.
It's only 35,000. That's like the lowest department bills I've
It
ever
was a
seen in my
really
life.
small stack. It took me like 10 minutes to look at them. They were really small. Wow. If you looked at the list, most of them were Northwestern Energy bills, was probably almost 90% of them.
Yeah, that came out like right before she sent the additional bills email.
Okay.
Oh, the additional bubbles.
Yeah.
Was that?
There was 2 of them.
But that was on the 15th.
They both
That must
came
have
out
been
on
for last
Thursday.
week's meeting, right?
Nope, that was for this week. She sent them out.
Okay.
What
There's your
date?
email on Thursday. there.
10:15.
10:15?
Yeah. She sent 2 of them. They were pretty back to back.
Yep.
It's not showing the times, but
So we got them, just normally usually out there for the public to see. At least there's department on it.
Move to approve.
The first one has a bunch of credits that started off. The first one has a bunch of credits that started off, so.
Yeah, you're on there.
10,
May I
15.
forward it to you?
I don't have it.
Oh, there you go. It's Elevon Merchant Services. Infotech for processing fees. Card Connect, 6,000 for.
They were sent on the 22nd, correct?
Yeah.
On Thursday.
Yeah, 22nd.
Yep.
That would have been the 22nd.
Department bills, 25,000.
I'll move to approve.
Second.
A motion from Councilman Reinbold and a second from Councilman Rux to approve those bills that were emailed to the council. Karl, why don't you give me a roll call vote, please?
Councilmember Renly?
Aye.
Hey, there we go.
Still hear me?
Yes.
We can hear you now.
back.
Thank you, Councilmember Renly. Ronayne? Lunsman?
Aye.
Reinbold?
Aye.
Langer?
Aye.
Rux?
Aye.
Mayor Shawneman?
Aye, motion does carry. Next, we've got the payroll, approval of the pay period from October 11th through October 24th, and the city's share of Social Security, old age, survivors insurance, retirement, health, and life insurance. Can I get a motion to make the payroll, please?
Second.
Motion from Councilman Lunsman, second. Councilman Ronayne. Karl, roll call vote.
Councilmember Rux?
Aye.
Langer?
Aye.
Reinbold?
Aye.
Lunsman?
Aye.
Ronayne?
Aye.
Remley?
Aye.
Mayor Shawneman?
Aye, motion does carry. We've got the city manager's report. Joe, what have you got for us?
Thank you, Mayor. Just really one thing, kind of as a follow-up from last week, Councilman Rux asked the city attorney about authority regarding mask mandates and those sort of things. That's generated a little bit of media coverage, a couple of different reports, both in television and newspaper. And from that, it seems we've kind of started getting in the office some calls about folks liking the idea of mask mandates. We assume that will probably continue to grow and potentially be joined by folks that don't like the idea of a mask mandate. So I just wanted to run the idea past you if we continued to gather that data this week and how you felt next week. If we presented that to you, really showed you some options, maybe followed up on some of the comments from tonight and see what we can bring you as far as just some information on different ways to potentially go with this. Because this is an extremely, when you start talking about additional mandates or things like that, this is going to be really volatile. And it's going to be something that's very difficult for staff to make a recommendation because it's going to be tough for us to enforce. So I just wanted to see what your thoughts were if we bring that to you. And then just encourage folks, if they do have a comment that they'd like us to include in our reporting, as we've been doing, if you call 626-7025, you'll be logged in. Hopefully you'll identify yourself. We're getting several that aren't, but we do want to hear what your thoughts are, and if the council's open to it, we'll bring some thoughts to you next week.
Sounds good. We'll take a Councilman Rux. Have you got something to add?
Not for the mask thing. Robin, they have 15th open, south of Mayoverby. I just want to say it rides nice. It looks like they did a good job finishing it, and I'm glad they got it done before the snow.
Yes, with early snows like this, it could have been a really bad scenario for us. You know, we ended up doing the tie-ins right before the snow just so we could get it done. Actually, it was on the brink of snowing at the time, and we'd probably still be sitting here with it not done. If we hadn't done it, there may be some touch-up we'll have to do come spring, but that was a decision we had to make in order to make sure that it was open for the public, so.
Thank you for getting that open, too.
And while you're up there, I'd like to commend you for the snow removal process. I know the first one of the year is always the buggiest of them all, so very few complaints this time.
It's a challenge. we had a lot of different scenarios. Some were COVID related, some were equipment delivery related. Because this was so early, we were still getting our equipment in as we were trying to deploy it out into the field. So this was a challenging one, and our guys did a great job, and we hope we don't have too many of them, but it was a good start for us.
Yeah, I was going to say, hopefully you can guarantee that we'll have less of these in the future because.
Mayor
we're ready
Shamman,
for
can
it.
I add something to
Councilman.
this? This might be a good time. Maybe it'll make its way to the paper or not, I'm not sure, but we have people in the community when there's a snow situation like this last week that maybe they think they're helping by doing some plowing or clearing some area of the street. But what we find is that it creates a lot of confusion with our ordinary snow removal operations. And we actually had an area of town, just a few blocks, I think, that people thought had been plowed by the city, had not yet been plowed by the city, and people were parking their vehicles there only to get then ticketed and potentially towed later on because the city had not yet plowed that area. So what that creates is issues both for Robin and his crews as they're trying to get out there and identify what needs to be done and continue the path. Plus, frankly, it creates some issues for the city trying to deal with angry people wondering why did they get ticketed. And so we just would remind folks that as tempting as it may be to get out there and do a little self-help, at least in the streets, you really shouldn't do that because it does become quite disruptive and it creates issues that people don't understand that they would create.
Understood. Well, I guess then in addition to reminding people to wash their hands and take other CDC precautions, also don't plow the streets. Councilman.
This kind of goes back to the informational thing. Does the city have an email or something where like someone just wants to email general information, or does it actually have to go to a person? I mean, I know I get emails, but I may not get the same emails like what Dave or Justin or Tiffany or the mayor or whatever get. But I didn't know if like they have a, info or something that the city has.
I don't think we do, quite frankly, but we probably all get those emails. They go to the website and they find us. And
Well, just like a catch-all, like even if someone just, I don't know how hard it would be to monitor, but like, let's say there's a pothole, or.
We do have a public works, you can click on a few different spots on our website in the public works arena. It is monitored. They forward them to me.
Okay.
So we do.
So
have
each department has sort of its own, there's not just one where, kind of like a.
You go into a department, it'll say email, and you click it, it may go to me, it may go to our public works one, but yeah, there's some. Yeah.
Okay. But like, especially like for, as issues come up, like I said, some people may call, but I know we have staff that, their time is valuable as well, and other people may want to email, but, just a general email. I didn't know if we had one or not where they could just email, a comment that, hey, I want this, as part of a record or something.
If I may, Austin says he thinks that there's a city hall at aberdeen.sd.us that goes to Marie in the city manager's office that then she would forward it to any applicable departments.
City Hall at aberdeen.sd.us.
City Hall, all one word, at aberdeen.sd.us.
Sure. And then, as kind of city manager was alluding to earlier, the identifying yourselves and that you're a city resident rather than under the cover of anonymity sometimes works better to be able to screen these things and make sure that they're legitimate comments and concerns. And with that, I will take a motion to adjourn.
Moved. Second.
Motion from Councilman Ronayne and a second from Councilman Lunsman. We have one member on the screen still. So, Karl, last roll call vote of the evening, please.
Councilmember Remley,
Aye.
Ronayne,
Aye.
Lunsman,
Aye.
Reinbold,
Aye.
Langer,
Aye.
Rux,
Aye.
Mayor Schoeneman.
Aye, motion does carry. We are adjourned. Thank you all very much.